If we could pause quickly, Tommy, and pin it with that ApoE, can you go
Mm.
down that road a little bit? Because that's definitely one with the rise of getting people's genetic tests run
Mm.
from a nutrition standpoint. This is often the one that clients will have run. And then as they come into a practitioner's office or a doctor's office, this is a conversation starter around, am I at greater risk? What does all this mean? And I think there's a lot of confusion around that.
Yeah, it's a great point because it's something that we've become very focused on, even though I'm not sure how helpful it is, and for a few
It's a
reasons.
good way to sum it up.
So in modern westernized populations where we've done these studies, so the US or the UK or parts of Europe, you see that people who have either one or two copies of ApoE4. So there are three different genotypes for this SNP. It's 2, 3, and 4, and you obviously have two copies, right? So you can have one or two copies of 4, or one or two copies of 2 or 3, and some combination of them.
Mm-hmm.
And if you have one or two copies of ApoE4, your odds, which is the probability divided by 1 minus the probability, which is difficult for people to get their head around unless they bet on sports.
Then it's dialed in.
But the odds of Alzheimer's disease are increased maybe 6 to 20 fold, depend, if you have ApoE4 in that population. However, this is what's said commonly, that not everybody with ApoE4 gets Alzheimer's disease, and most people who get Alzheimer's disease don't have ApoE4.